Hello and welcome to my channel. My name is Ansel Weber and I'm a first-year family medicine resident. I make videos about things that I have learned that I think you would find useful or helpful. Let's get to the video. Alright, today I'm going to show you how to take notes for a patient history as a medical student. Someone explained this to me. A fourth-year med student showed me how to do this when I was a third-year med student, and it was super helpful. So you take your sheet of paper and you fold it into fourths. You fold into fourths like this. Takes 3 seconds. So you have this, and now you write down these items. This is PT for patient. Write the patient's name, age, and then you can put like their sticker up there if you want to. Then you write their past medical history up here. This is in the same order that you'd present to your attending. So you'd say like, Mr. Jones is a 67-year-old male patient with a past medical history of blah, 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 blah. So you write your past medical history right up here, and you're getting this while you're taking the history from the patient. And then you do your HPI, your history of present illness. You go through like your 7 dimensions or your old cards or whatever. I'm still terrible at this as a resident. I just like write everywhere. I would suggest doing like little bullet points as you get each piece of information from the patient to make it a little bit more organized. And you can ask them about their surgical history. FH, that's family history. SH, social history. Make sure you always ask about drugs, alcohol, smoking, current meds that they're on, and allergies. So you've already gone through your HPI and then your 6 other questions right there. And don't forget your review of systems. That's up here. You can just go head to toe. I always ask patients, do you have chest pain? Do you have shortness of breath? Do you have any abdominal pain? Any changes in bowel and bladder habits? Do you have a headache right now? Do you have any changes in vision? Any new rashes or skin changes? And then tailor it based on what the patient's chief complaint is. So if they're negative on things, I just do a little circle with a slash through it so that I know, and I say like no CP, no chest pain, no shortness of breath. So that's how I'd write it right there. PE, that's your physical exam. Once you get better at this, you'll just write pertinent findings or positive findings probably. And then labs down here, you can do your fishbone for your CMP, and then your little X for your CBC or any of the other pertinent labs that may have been ordered if you're working in the ED or you're working somewhere in the clinic. If you're in the clinic, you probably won't have recent labs that have been gotten, but you might. Imaging, X-ray, CT, whatever. And then your assessment and plan. I remember my very first rotation when I was a third year. I would do this whole presentation. I'd be really proud of myself, and I'd come into the attending, and then he would sit there and he'd say, assessment and plan, and I hadn't even thought that far ahead. Remember your SOAP notes: subjective, objective, assessment plan. So you're gonna look like a rock star med student if you have an assessment and plan ready. Even if you don't know, just make your best guess, add an assessment and plan, and you look good for your attending. So here is how you take notes for a patient history as a med student and beyond.